procedure to patients. Whenever you are coming to perform a task on a patient, as a nurse, you must be professional. You can't just go and start working on the patient and the patient doesn't know what you are doing and why you are doing it. So the first step of explaining procedure is to inform the patient. That one is done as soon as you know you have to perform the task. You inform the patient that I'm coming to bath you in bed. Before you go and pick your items that you need. In informing the patient can tell you that if you are going to bath him, then this is the soap I like. Then this is my sponge. Then if you are going to brush my teeth, then this is my toothpaste. If you are coming to dress my wound, then this is the solution. The nurses keep it with me all the time. Because working with the patient should be private. There should be some form of privacy and confidentiality in it. What you are coming to explain to the patient, don't forget that a third person shouldn't hear. That is why you should screen before you start explaining the procedure. Note, informing patients, you don't have to screen the patient. But you inform, you go and pick your items, then you come and screen. So, in explaining the procedure proper, there are 4 things that it should appear in all of them. The name of the task you are going to perform, not the technical name that the patient won't understand. I'm coming to do wound dressing without assistance. Patient doesn't understand. Just tell the patient I'm coming to dress your wound. Say something patient will appreciate the task, like patient will understand what you are about to do. So tell patient what you are coming to do. The importance of the task to the patient, that's the second thing. Patient to know the benefit of what you are going to do. You are not going to list all the importance of wound dressing to patients, all the importance of checking vitals, but at least say one. All these things can be done in one sentence. The name of the task, the importance to the patient. The third one is the role that the patient has to play. In performing the task, should the patient act dead? Patient should do something to help you to perform the task. So patient's role should be explained to him or her. Then the fourth, the discomfort to expect. Yes. Is there going to be a little pain? Is there going to be some form of invasion of privacy? You are going to bath patient in bed. Let the patient know that because you are bathing him or her, you expose his private parts. You have to bath the armpits, under the breast. If it's a male, you are going to bath around the genitalia. So explain to the patient any discomfort to expect. Then you seek consent. After explaining all this, you ask, please, do I have the permission to do it? That is why most students say that, what if the patient says no? When patient says no, then you have to re-strategize and explain more why the task needs to be done on him. For his benefit, explain the benefits it will be to him. And then you find out why the patient is not giving you consent. Maybe that moment patient wants to visit the washroom. That is why you have to tell patients, when you inform patients earlier before you go and bring your items, patient can tell you, oh, then I'm going to the washroom, by the time you come I'll be back. That's why you don't bring your items before you come and tell patients I'm going to do a procedure. So if patient refuses to give consent, find out the reason for the refusal and reinforce the importance it will be for him or her.